Hello, dear viewers, and welcome to a brand new episode of Doc Talks, your weekly guide to understanding better health, the medical topics that matter most to you and your family. In today's episode, we'll talk about something different. Childhood is no longer what it used to be. Today, children live in a vast world where learning mixes with entertainment and opportunities overlap with challenges. Social media may be a tool for gaining knowledge and communication, but at the same time, it carries risks of bullying, isolation, and the pressure of comparisons. Our talk today will be about protecting our children from the negatives of the digital world and cyberbullying with our guest, Dr. Zainab Alsahhaf, pediatrician and member of the Child Protection Team. But first, let's take a moment to learn about our guest, and then we'll be right back. Stay tuned. Welcome back, dear viewers, and I am pleased to be joined here by our distinguished guest, Dr. Zainab Alsahhaf. Hello, Dr. Zainab, and thank you for joining us.
Hello, thank you so much for having me.
First and foremost, Doctor, can you tell us what is the autism spectrum?
So, autism spectrum disorder is a neurodevelopmental disorder, and it's characterized by specific features. The key features are patients usually have impaired social interaction. They have difficulties and challenges with social communication.
Yes.
The other features that we notice also that they have, some repetitive behaviors and restricted pattern of, interest, activities, and behaviors. And the reason why we call it a spectrum, because, the symptoms and the severity of the symptoms can vary widely among patients.
I see. And what is the difference between autism and other developmental disorders?
So autism is characterized by distinctive features that you cannot see in other neurodevelopmental disorders. Sometimes they might overlap, but has very specific features. So when we talk about, difficulties and challenges in, social communication and interaction, you will notice that the child has poor eye contact. They don't respond to their names. Some of them tend to be withdrawn. They don't have what we call shared enjoyment.
Yes.
Usually normal children, they like to show you what they're interested in by gesturing, using nonverbal communication, pointing out. You will see that these features lack in a child on the spectrum. The other main feature is the restricted and repetitive patterns of behaviors and interests. You will notice they will have specific repetitive movements, like, for example, hand flapping, spinning, rocking their body. I have one of my patients, he's interested in switching on and off the light switches. Some of them, you notice that they arrange the toys in a specific order, on a specific pattern. You can see them even hyper-focused on a specific part of the toy. Like, for example, he's only interested in spinning the wheels of the toy. Other children, they have sensory issues. They can be sensitive to certain smells, certain sounds, even the texture of certain food items.
Yes.
So that's what makes, autism special and different than other neurodevelopmental disorders.
That's very interesting. And now, so is there different levels of autism out there?
Yes, definitely. So in the past, autism spectrum disorders were divided into different types, like Asperger's syndrome and other types. But today, doctors and healthcare professionals, they categorize autism spectrum disorders based on the severity of the symptoms.
I see.
So some patients will have, very mild symptoms, so they require very minimal support and help, while others, they will exhibit moderate to severe symptoms. So they need, and they have more challenges, more difficulties, and they need significant help and support in their day-to-day living activities.
So when you talk about these symptoms, what are some of the early signs that a parent needs to look out for?
Yeah, that's a great question. So the early signs can be detected as early as the first 2 years of life. Like we have mentioned earlier, poor eye contact, and some of the children, they don't respond to their name. They can present with speech and language delay. And actually, the majority of the cases that present to us as general pediatricians in the clinic, they present with speech delay. Other features with the repetitive behaviors, repetitive like hand flapping, certain hand movement, spinning. Some of them, they can be withdrawn. They don't enjoy playing with other kids. There is another symptom called echolalia. Echolalia, it means repeating some tunes or some words without actually understanding, without knowing the meanings. They just keep repeating certain phrases.
Mm-hmm.
And another important symptom, that some children with autism, they have sensory issues. For example, hypersensitivity to certain noises or certain smells. I have also one of my patients, he is very specific. He will only eat food items that are colored white. He would refuse to eat anything else. Another patient, he would eat the food items if they are cut in specific shapes and patterns. And of course, these sensory issues, especially the sensory food issues, it can lead to so many nutritional deficiencies. So we really have to be careful about
exactly
those.
Like when you say foods that are only white. Now, I'm trying to list them right now, like rice, yogurt, and what else, you know, like. So I think you're absolutely right. It could lead to deficiencies in their
nutrition.
Yeah,
Yes.
yeah. So when can you tell, like, our dear audience that are watching at home, if they are parents, when should they go and get an evaluation?
Yeah, so the answer to that is definitely as early as possible.
Mm-hmm.
I always encourage parents to trust their instincts. If you notice any of those early signs of autism on your child, if you feel there is something is not right, don't hesitate to book an appointment with a developmental specialist or a general pediatrician to get your child checked. Because so many studies have proven that early evaluation and intervention leads to better outcomes.
So is there any known causes of autism, like, let's say, environmental or genetic or something like that?
The exact cause of autism spectrum disorders is not fully understood.
Mm-hmm.
It's what we call multifactorial. It means like a combination of both environmental and genetic factors. When we talk about the genetic factor in the development of diseases, autism, like any other disease, genetics definitely play a role. We see that autism sometimes runs in families. That's why when we evaluate the patient, we take a full family history.
Yes.
And we ask if there are other family members who suffer from autism or other neurodevelopmental conditions. Regarding the environmental factors, honestly, there is no specific environmental factor known to increase the risk of autism. But generally speaking, any complications that happen around the time of pregnancy or during the process of birthing the child or soon afterwards can slightly increase the risk of autism, but there is no specific correlation.
I was just going to ask you about that. So is there a relation between pregnancy and that period for a woman and autism?
Yeah. So definitely the period of pregnancy is a very vital period that women go through.
Yes.
And of course, anything that go wrong during that time or during the delivery process, like maternal infections, which means infections that happens during pregnancy to the mother, and congenital infections, any bleeding, premature birth, reduced oxygen during the delivery can potentially increase the risk of autism and other developmental disorders. But we want to stress on the fact that there is no specific correlation between the two, which means that some children who were exposed to those complications do not necessarily develop autism.
Well, Dr. Zainab, would like to pause there as we have a report to watch, and we'll be right back to our conversation. Now, dear viewers, as usual, our camera crews and everybody behind the scenes have been working diligently to bring you the best content. And we do have this report that ties into the subject, and let's watch it together, and we'll be right back. Stay tuned. Welcome back, dear viewers, and I am still joined here with our distinguished guest in the studio, Dr. Zainab Alsahhaf. Now, doctor, what is the suitable age to detect autism early?
So the early signs and symptoms of autism can manifest as early as the first 2 years of life. So again, we encourage parents and caregivers to be observant, and if you notice these symptoms, don't hesitate to seek help, because many evidence and high quality studies showed that early interventional programs and early evaluation can greatly improve the outcome in children with autism.
I see. And how is it exactly diagnosed, and what are the main tests or assessments that can be done?
So the diagnosis of autism requires a comprehensive developmental evaluation, usually carried on by a certified pediatric developmental specialist. We have to understand that there's no like single blood test or brain imaging that can diagnose autism. Usually healthcare professionals use multiple tools, screening tests, questionnaires, checklists, doing head-to-toe examination, taking extensive history of the patient and family, and doing multiple visits. Sometimes it requires multiple visits to come up with the diagnosis and confirm the diagnosis of autism. So it's a multidisciplinary and comprehensive process.
I see. And so, doctor, can you tell us what is the difference between a shy child and a child with autism?
Yeah, that's a great question. See, a shy child, sometimes can be, withdrawn and hesitant, or maybe refuses to talk in certain social settings where they feel uncomfortable or they're surrounded by strangers. But once they warm up, you will notice that they will speak out and they will behave normally. And a shy child, he will not have other developmental abnormalities. They attain all their developmental milestones as expected. Whereas a child with autism, he will have persistent features. So it's not merely shyness. No, they will have persistent impairment and challenges with social communication.
So what about the main behavioral therapies that we have today? What kind of behavioral therapies do we have?
So we have so many forms of therapy that are offered to support a child with autism. Main behavioral therapies, they can teach children with autism how to express themselves, how to improve their communication skills. They can also undergo speech and language therapy to help them express their emotions and their needs better. There are also occupational therapies. What an occupational therapy does is to help the child with their day-to-day living activities, and to help them reach their maximum potential and become hopefully independent in some areas of their lives.
So we talked about behavioral therapies. Can we shift now to what kind of medical treatment for autism is available?
See, there's no medication to treat autism. However, doctors and healthcare professionals can prescribe medication in certain situations to control the symptoms associated with autism. So, for example, if the child has, irritability, or hyperactivity, or if they have, sleep disturbances, insomnia, or they have problems with their eating, or they're not gaining weight, then we can use a specific medication or treatment plan to control those symptoms.
I see. And how important is parent participation when it comes to treatment in general?
Parents' participation in the management plan is vital, and I'm a true believer of parent involvement in the decision-making process with every pediatric patient.
Of course.
Because when you involve the parents and you empower them with information and knowledge, and they attend the behavioral sessions with the child and they learn some of the skills, they can actually reinforce them at home. And this showed by so many studies that it makes them progress faster and better to reach their maximum potential. And it also creates, a strong bond between the parents and the child, and also creates, a trusting, collaborative relationship between the physician or the healthcare providers and the family.
Well, Doctor, we'd like to pause there as we go to this report that we have prepared, and we'll be back to our conversation. Well, dear viewers, we'll go to this report, and you don't want to miss this next part. It's one of my favorite segments, which is Myth or Fact, where we present a statement to our expert and doctor here in the studio, and they will tell us if it is indeed a fact or a common misconception. Stay tuned for that and much more. Welcome back, dear viewers, and I am joined with our distinguished guest, Dr. Zainab Alsahhaf. Now, Doctor, we move on to this segment, which is Myth or Fact. I'll present you the statement, and you can tell us if it's a common misconception and what is the fact.
Okay.
Or you can debunk the myth, basically.
Okay.
So, vaccines cause autism.
That's absolutely not true. There's no scientific evidence to support that.
Mm-hmm. A child with autism does not feel love.
That is, again, not true, because children with autism feel all the emotions. They just express them in a different way, in their own unique way.
All children with autism do not speak.
Some children with autism, they will present with speech and language delays, while others actually have exceptional verbal skills.
What about this one? It says autism means low intelligence.
That is absolutely not true, because, intelligence differs among all children. And some children with autism might have some challenges and difficulties, but again, others, they might have exceptional abilities. Mm-hmm. So not necessarily.
Okay, doctor, now for this next one, it says a child with autism cannot be included in school.
In the right environment, with the right school and right support, they can definitely be included, and they will be thriving in that environment.
Is it okay to mix with the other students in this case?
Well,
actually, that be too distracting?
It depends. Mm-hmm. It depends. When you talk about autism spectrum disorder, again, it's a spectrum. Every child is different. Every child has his unique needs. So the management and the support they required has been individualized.
Mm-hmm. So would you say it needs more attention?
Definitely. Definitely. And it needs, special care and more attention.
Okay, now, doctor, we move on to the next one, which is children with autism never smile or make eye contact. Well,
children with autism have some difficulties and challenges with, social communication. They might have poor eye contact, and some of them, they do not smile back, but other children, they have actually good, adequate eye contact, and they can smile back. And even the ones who had some defects in that, with behavioral therapies and social skill training, these symptoms can improve.
Myth or fact, a child with autism cannot make friends?
Well, again, going back to the right environment and with good social skill training, and when you give them the right support and the behavioral therapy to improve their communication skills, they can make friendships and relationships.
A child with autism always lives in isolation.
Not true. Not true. Some children with autism, they enjoy, being with others and the companionship of others.
A child with autism cannot understand other people's feelings or basically have empathy.
Well, children with autism might have, challenges and difficulties in that area. But again, with early evaluation and intervention, they can understand feelings and respond to them.
Well, doctor, we'd like to take a break there as we do have a report to see, and we'll be right back to our conversation. Dear viewers, let's watch this report together that we have prepared, and we'll be right back. Stay tuned. Welcome back, dear viewers. If you're just tuning in, you're watching DocTalks, your weekly guide to understanding the medical and behavioral facts that matter most to you and your family. And I'm still joined in the studio with our distinguished guest, Dr. Zainab Alsahhaf. Now, doctor, we move on to this final segment about family and educational support. How do parents accept the diagnosis of their child?
That's an excellent question. So, at the beginning, receiving a diagnosis of autism can be very emotionally overwhelming for the parents and family. But once you put them on the right path and you connect the child and the family with the resources and the support they need, and most importantly, empower them with knowledge and information, they will reach that place of peaceful acceptance. So it's a journey.
It is, and it's true. You're saying it is overwhelming. So let's say they have been diagnosed, and what is the first step they should take?
So once they are diagnosed and they went through the evaluation, they have to, of course, develop a connection with the healthcare provider. They might need to follow up with multidisciplinary care, like the general pediatrician, the developmental specialist, behavioral therapist, speech and therapist, occupational therapist. So at the beginning it might be they might be overloaded with appointments, but our role in the healthcare system is to provide them with all the support they need.
So what are some of the daily challenges they can expect, the parents?
Parents who have an autistic child, they face so many profound challenges on so many levels. First of all, the communication barrier, especially at the start of the diagnosis, they might have challenges and difficulties communicating with their child, understanding what their child needs. Some of them even have, challenges on the psychological and emotional level, because initially they feel, withdrawn and isolated from the society. I have noticed some parents, they avoid attending family gatherings because they feel so misjudged, they feel judged or misunderstood, or sometimes they feel, for example, embarrassed of certain behavior displayed by their child.
Yes.
Another challenge is, juggling the responsibilities of life, work, raising other children, and the huge responsibilities of taking care of a special child, like a child with autism.
And what kind of recommendations can you give parents if there are, behavioral, repetitive behaviors, or let's say tantrums from the child?
The most important thing is to stay calm.
Yes.
We ask parents to stay calm, take the child to a safe environment, away from maybe from any areas that has, harmful objects or, rough or hard objects where the child might hurt himself or others. Take them to a quiet room, maybe dim light that doesn't have so much noise and visual stimulation, and help the child to calm down. Another method is always recognize the triggers and try to avoid the triggers, because tantrums are usually, they start by certain triggers. So always make sure that your child is having enough sleep, is well fed. If he's taking any specific medication, don't miss out the medications.
Yes.
That's basically it. But the most important thing is just stay calm and deal with the situation calmly.
Okay, so doctor, do you have any message perhaps to our dear audience that are watching at home?
Yeah, so my message is, autism is not the end of the road.
Mm-hmm.
And I encourage families to have faith, patience, and compassion, because, again, with the right support, they can have a very fulfilling life, and they can improve their quality of life and reach their maximum potential.
Well, Dr. Zainab Alsahhaf, pediatrician and member of the Child Protection Team, it was a pleasure having you on our show today. Thank you for joining us once.
Thank you. The pleasure is mine. Thank you.
Well, dear viewers, that concludes today's episode of Doc Talks. We hope you enjoyed the journey as much as we did. We thank you for spending your time with us and keeping us company. Until next time, stay healthy, stay informed. Goodbye.